can virtual reality and specific tailored media content able to help us to reduce chronic pain as well as improve our engagement with dementia patients. Today, we are showing you two innovative solutions that are leveraging these tools to improve our engagement with these difficult chronic disease patients while streamlining the workflow from both the patient experience, caregivers, and clinicians alike.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
I'm so thrilled that I got a chance to be interviewing multiple innovative solutions at the last 𝗣𝗶 Summit back in February of 2024. And today we're going to feature two of these solutions. And first up is Celine Tian, a visionary in the healthcare space who is tackling chronic pain from a whole new angle, leveraging virtual reality. Her company is redefining the approach to how we really feel, evaluate, and engage with pain and anxiety management to help people better manage these symptoms. But it's not just about distraction from the pain itself. They're actually coming out with virtual reality and biofeedback to teach people how to better manage these symptoms on their own with their nervous system and turning it into better regulation. What really struck me is Celine's personal experience dealing with pain and seeing firsthand the challenges of pain management with her loved ones. And that drove her to create these solutions that truly addresses not only the physical pain, but also the anxiety and isolation that come around experiencing pain. Now, stick around to hear more about this technology, how it's changing our daily lives.
Hi, this is Sabrina Runbeck with Caregiver Worldwide Network. We're here at 𝗣𝗶 with another fun funder to learn about how we can truly improve the healthcare delivery system and with our patients and caregivers. So here is Celine Tian with 𝗏𝗏. So tell us a little bit more about you guys' mission. What's the storyline behind forming this company and what are you solving in healthcare?
Yeah, thanks for having me, first of all. So my name is Celine Tian. I'm the founder of 𝗏𝗏, and I was inspired to start this company because I grew up around loved ones with pancreatic cancer, which you may know is extremely painful. And so the idea of pain management and all the things that come with pain, like anxiety, trouble sleeping, even feeling isolated, were all parts of the pain experience that I felt needed to be addressed. And so my team and I founded 𝗏𝗏, which is a virtual clinic for pain recovery, but also anxiety management, to really help people address the physical pain they were feeling, but also the psychological pain like anxiety, depression, or even feeling alone and isolated in the experience.
Right, we know are a lot of different diseases that are very detrimental. Doesn't matter if just the progression of the disease or once you start getting treatment, and those are hurting people. And then even though we know it's a life prolonging, we're really trying to get rid of the treatment. So for you guys, it's really tapping into the space of how do we support people from different angles, especially when they have this very devastating news to them, and then be able to say, hey, from a patient caregiver, sometimes they don't have the resources to be able to tap into what mental health really can do for us. Now, as the exciting journey that you guys put on, what has been some of the bigger wins for you?
Yeah, I mean, for us, we've been researching and looking at the space for many years now. So we're really excited to bring it to the public and to bring it to patients and also caregivers everywhere. For us during COVID, I think a big win for us was being able to serve not just patients that had chronic pain or had cancer with pain, but to also serve the caregivers who are feeling burnt out, who had anxiety, who also had pain themselves, and we were able to address that better with them. And so we were serving not just the patient, but also the family at large. And that was really rewarding for us to be able to do. And to give you a sense of like how that would work, we bring in patients, we identify like what are their needs, what are their goals. They work with a therapist and a coach, and then we actually send them a kit that includes a virtual reality headset and a heart rate sensor. And so from the comfort of somebody's homes, they could engage in these like beautiful virtual worlds, like they're sitting on the beach with the aurora lights above them, or they're wandering through a bamboo forest, but at the same time, they're learning how to control their heart rate and regulate their nervous system to shift their body from a fight or flight mode to a rest and digest mode. And as you can imagine, that's something that's helpful for patients, but also the people that take care of them as well, to help calm and relax their day.
Right, and that agitation and pain is something very subjective. It's hard for any of us to imagine what the pain level individual are experiencing. And from a clinician side, we don't have that much tools. And that's why there's such a big problem in the space to say, what are the drug treatments and what are the alternative that we have to support patient? And you guys have a virtual system that can really help them to self-regulate and not just have to rely on all the drugs that put them into a different state, which have so many side effects.
Yeah.
Now, when you are needing to put this in the right hands, and so the people can actually benefit from all the right resources, what have been some of the go-to-market strategies that you guys have been using to?
Well, I think a big one for us, which is back to your earlier point about being an integrative solution, so not just being medication or just being pure non-medication. Like, we really believe in working with a larger ecosystem, but also with a patient's bigger care team. So for us, one big thing has been working through providers. So when a patient already has like a physician or a therapist they work with, we often come in at the referral stage where they're bringing us in as a tool or a complement to the program that they're already using. So that's been a really big way we've brought ourselves to market, is through provider referral. We now also work with certain health plans and employers to get this out to a larger member and population.
And have that physician referral mostly from the pain management subset or all across the board?
That's a really good question. So we work really across the board. So we've had like a family physician refer us, pain physicians, therapists, even cardiologists for patients that are suffering from POTS, or folks that are diagnosing and helping with autoimmune illnesses are also a big part of it.
Yeah, that's great that you're able to say pain is not just isolated in one disease set. It actually can be a variety of things. And so then we can help support people, especially when we think about that holistic way and that alternative therapy. People start wanting to get away from just drug, the chemicals pumping into our body, but other ways that we can truly be able to help each other and help our patients at the end of the day. Now, when you're thinking about the journey of entrepreneurship, is exciting. There's always ups and downs. You get big wins, and then sometimes it's in the moment of, oh, I wish this thing happens much faster. So if we give you a magic wand and that can make one big problem disappear, what would you use the wand for?
I think for us, because we have worked so much on the science and the clinical efficacy of our clinic and our product around virtual reality and biofeedback therapy, I feel sure on the science side, but what I'm not as sure on is how do we get it to people's hands where it's covered, where it's reimbursed, right? Where, folks that are coming from low income background or just don't have the out-of-pocket budget to be spending on alternative therapies are getting access to this. And so our big goal is to get into, everybody that needs 𝗨𝗨, get it into their hands where they don't have to pay for it themselves. So the magic wand for me is really getting 𝗨𝗨 covered and reimbursed by health plans or employers or whatever organizations that's required, so people can have access.
Right, so that means this have been one of your focuses, talking to payers to help them to come up with a plan to actually get this paid for.
100%, yeah. A big part of what we do is trying to figure out what are the right organizations and plans to work with so that we're really getting 𝗨𝗨 into the hands of the people that need it.
Right, and that means if people really want to get their hands on the technology right now, it's a self-paid model where they can get the kit sent to their home. Yeah,
so right now, 𝗨𝗨 is accessible online to folks as a direct-to-consumer program. So you would go on www.𝗨𝗨.world and you'd be able to sign up for 𝗨𝗨 and try it today. But we are working with certain health plans in different states, so if you reached out to us, we'd be able to let you know if it's available for you.
That's great. It's really about accessibility, as you're saying, getting to the right hand, because no matter what we create, if the end user are not getting them, then we don't really truly know the true impact that can be effective and then truly be a leader in this market for these patients. Now, we love events. Events about energy, learning. Now, what truly brought you to 𝗲𝗏, and what are you hoping to get out of 𝗲𝗏?
Yeah, I think for us, it's always exciting to be around other founders and other innovations in the healthcare space, because there's always room for partnership. Oftentimes, we are partnering with other vendors or other solutions in cancer or maternal health, where we're really coming in and helping serve, like addressing the pain recovery side of those conditions. So I think that partnership and collaboration is what a lot of time draws us to something like 𝗲𝗏.
Amazing. Now, how can people find out more about you guys, whether it's from a conversation to have with a company director versus just from a consumer side to say, hey, I want to check out the product?
Yeah, so the best way to reach out to us is our website, which is www.floly.world. And we have our email up there. We even have a call line that you can call and text, which we make available to everybody. So really reach out and ask any questions you might have.
Thank you so much for sharing this new technology with our patients and caregivers. And we appreciate you and looking forward for all the amazing journey ahead.
Awesome. Thank you so much.
So what's your number one takeaway from that quick interview that we had with Celine and her company, 𝗏𝗏𝗏𝗏𝗏? And 𝗏𝗏𝗏𝗏𝗏𝗏 really is about reimagining pain management through virtual experience. And they're not just creating distractions, they're building how you regulate neural feedback with anxiety and pain, a comprehensive virtual solution that teaches people to really self-manage. And at the end of the day, when we have the power of tools to work on ourselves, that is something that cannot be taken away from us. So really, their approach is about addressing the physical and psychological aspect of chronic pain and offering a logical solution that could significantly improve patients' quality of life and the stress that come with pain. Now, it's a primary example of how technology really tapped into our own relationship with how we approach symptoms. And it's not just another game, it's another experience. It's crafting the right approaches, leveraging tech. And yes, you might think virtual reality might have a cost attached to it. And that's the many difficulties for the companies out there is considering how they can create these things that's billable under insurance plans so people don't have the additional out-of-pocket cost of using a device at their home or at the office. All right, but the best part is we're moving forward. We definitely be more creative with gamification and seeing what the research have on multiple different areas of life and coming together. All right, so what do you think about leveraging a tool like virtual reality for your own potentially managing the aches, the pains? It doesn't matter if you have chronic pain or even the pains that we experience from that heavy workout session, the marathon that you just ran. All right, so if you're listening and thinking you have an amazing story to tell, you are a leader in the space, then we wanted to hear from you. Go to 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 to see if you will be our next speaker. And we can't wait to see your journey and highlight it with us. Okay, next up is our speaker, 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏, CEO of the company that's reconstructing how dementia care is being managed with caregivers, and especially through interactive media solutions. 𝗏𝗏's insight on caregivers support and patient engagement truly is eye-opening on how we can learn and take care of our dementia patients as well as family members. So are you excited to tackle this solution? Let's stay tuned and hear about 𝗏𝗏.
Hi, this is Sabrina Runbeck. We're with the Caregiving Worldwide Network, and here at 𝗲𝗏, and Joining us is 𝗏𝗏𝗃𝗏𝗃𝗏𝗃, and we can't wait to dive a little bit more into you guys in the innovation space. So tell us more about what's that mission and story behind your company, and how are you uniquely solving an issue in the healthcare business?
Sure. So our company supports dementia caregivers. And my partner in the business was a dementia caregiver to her husband, who was diagnosed with frontotemporal dementia at 47. And 𝗍𝗏 is a response to the things that she saw with him, caring for him, what is good, appropriate media for someone living with dementia, and how do we use that media to reduce caregiver stress, reduce anxiety and anxious behaviors, connect people to engage and have meaningful moments of joy, and generally just help other people with activities of daily living.
Exactly, and dementia has so many spectrum of different types, and I had a family member who got diagnosed very late stage, so by the time they're already talking in derailment, where we have conversation, it's not really a conversation, it's one sentence lead to something else and you don't even know where they're going with it. So definitely from a caretaker perspective, we're confused on what to do with that, and despite of me being in the healthcare and being a clinician, still are worried about what that engagement is looking like. And for you guys to come up with this solution, what do you see has been one of the biggest success so far on your journey?
So I think we've heard a lot of amazing testimonials from our family members who use it. We're doing research with the University of British Columbia and Vancouver General Hospital, who found that 𝗍𝗏 in fact does the things that we hope it does. So it reduces agitation, it helps people connect and engage, and it helps ease activities of daily living. So, but the wonderful feedback, the best things are when we get an email from a family member who says, we just got 𝗍𝗏, my husband loves it, and they send us a picture, and he's eating breakfast, and they say that we watch the baby's video when he eats breakfast, and he thinks the baby's in his lap, and he's very happy, and he's contented, and I love seeing him that way, and I love being able to give him something that puts him in that state.
That's beautiful. So that being said, how are you guys been going to the market with what strategy to making sure this tool and technology is really delivered in the right hands so people can actually experience it?
Yeah, getting the word out is our biggest challenge, because we know when people do try 𝗍𝗏, they buy 𝗍𝗏. Our conversion rate is like 75% from a trial to paid. So that means that what they see and use works. And so we're using a variety of different methods to get the word out. We're heavy on social media, both organic and paid and marketing. We're just trying to spread the word through word of mouth. Caregiver groups are great. When someone goes to a support group and they say, hey, I'm using this, everyone else signs up because they hear it from a caregiver. And that's a trusted source. And again, that comes from Allison's background as a family caregiver herself. And we're serving people like her who need this as an essential tool.
Perfect. We always know that of all marketing strategy, definitely word of mouth converts 3 times higher, sometimes even more than any other marketing out there. Now, because it's a relationship building, it's truly getting into the right network and right association. Sometimes that can be the challenge in itself, to be able to know where do you tap into, who's the decision maker, how do you truly demonstrate so they believe in you to help you expand the goodness of that you guys are bringing. So if I give you a magic wand, because we know in business it can be ups and downs, happiness, and sometimes low points. So if this magic wand can remove one of the biggest challenges that you guys are facing and truly push out 𝗍𝗏, what would that be?
Well, the first time someone hears about dementia is in a doctor's office. So the first person that they look to for resources, how do I manage this, what's to come, is their doctor. So the magic wand would be every primary care physician, every neurologist, every doctor who's involved with diagnosing, detecting, and treating Alzheimer's and other dementias knows about 𝗍𝗏, believes in 𝗍𝗏, and recommends it to their patients.
Amazing. It's really getting the front end people, knowing where the information first get connected, and then help them to get early adoption into all the resources that they need right away. So then they don't have to both get hit with this big news that they're not prepared for. At the same time, like, what do I do? How do I support my loved ones?
And that's the first question people get upon diagnosis. And all too often we hear stories of a diagnosis being given without additional resources to help. And so we'd love to be part of that resource.
Amazing. We all love events.
And that's why we're at 𝗣𝗏. So what truly brought you to 𝗣𝗏, and what are you hoping to get out of 𝗣𝗏?
Sure. So we're very fortunate to be associated with the Age Tech Collaborative from AARP. And so they obviously have a huge presence at this conference, and they invite startups from the collaborative to be here and exhibit. And so that brings a lot of people towards us. The very interesting thing is this is kind of a business-to-business healthcare conference. There's payers, there's providers, there's solutions. But so many people have come up to us and said, my dad's got dementia. This looks interesting. Tell me about it. So it's been really satisfying, both to talk to potential partners at the business level, but also to help caregivers and hear their stories.
Yes, it's being in a room where all the energy is here and be able to connect with a potential partner who truly can push you guys to the next level, as well as the people that really truly need to hear about it. They are the end users.
Yes.
How can people find out more about you guys or connect with you directly to actually have a conversation?
Sure. So our website is 𝗦𝗲𝗹𝗂𝗃𝗏𝗂𝗹. You can go on there and see some of our content for free or sign up for a free trial. My name is 𝗏𝗏𝗹𝗂𝗃𝗏𝗏, and I'm the CEO. Anyone reaching out to me on LinkedIn or on social media, our social media handles are at 𝗦𝗲𝗹. We're on Instagram, we're on TikTok, and we'd love to interact with caregivers in that way.
Thank you so much for sharing.
Awesome. Thank you.
Okay, I think sometimes we listen to solutions and being exposed to them, and it just sounds like another one similar. These two has been demonstrating their value using tools and medias that are a little bit more outside the box. So we got on a journey today with Celine and Built, both from tackling chronic pain as well as the dementia care with patients, caregivers alike. And then we're seeing definitely a shift in technology addressing specific symptoms and challenges of understanding the patient in their perspective more. And how do we take control ourselves when we do have certain pain and challenges from the behind. And both approaches have a common thread. They are not just treating symptoms, they are enhancing the quality of life of that person. What strikes me as these technology are coming out in the marketplace is the personalized care that many of us are very focused and try to drive the change. It's not just one fits for all. And despite the researches that we as medical professionals are always looking at how many patient has tried with this profile, we still needed to niche down even more to the individual need, not like what we have been doing for decades ago. I'm really arguing that personal touch is the most important thing when it comes to medical decision making, both from the patient side, caregiver side, and clinician side when we are approaching treatment options. I'm curious how you guys have been perhaps involved, being exposed to virtual reality as a game or as a healthcare related things, whether you have tried it or you have curious enough to ask your provider about some of the options that could be existing out there. Have they even know about these options to talk to you and share with you, or are you advocating for yourself on these options for yourself or family members? And let's keep the conversation going. Share your insight on LinkedIn and tag me, Sabrina Runbeck. Love to hear what have you been experiencing, trying, exploring. What have you been more curious about and imagine to be the possibility? And share on LinkedIn, and I would love to have a conversation or even send me a personal message. Remember, in the future of healthcare isn't just a fancy tools and gadgets. It's leveraging these tools to make our life easier and make our patients, make our families, our own relationship easier. And as we live healthier, progressing to the next phase of our life, we wanted to be creating more impact, because if we are stuck in taking care of our families or ourselves when we're not at the best place, then there's no way that we can truly stand out as the leader, as the mover and shaker in the space. So love to hear how you guys are able to leverage technologies, whether for your own company and for yourself and caregivers in the space right now. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.